This is an interesting topic because I see people every day, every week that have been told, yeah, you're in the normal range. I don't know, you're just getting older. Interestingly, this last weekend, I was at a 2-day seminar with Dr. Abe Morgan-Taylor, the world's most famous urologist from Harvard that did all the studies to determine and proved without a doubt that testosterone does not cause prostate cancer. And so we talked testosterone for 2 days straight. He believes, as I do, that the number one blood test that anyone should have in an aging male or female, anyone over 30, is a testosterone level, free and total testosterone. And we talked about that a lot because it's not just what the free testosterone is. The total, it's what is the free testosterone? How much is not bound to protein? It's only 1 to 2%. So if you're at 500, it's only 1 to 2%. It's 10 at the very highest. And when you were in your 20s, for men, it was in the 20s. And for women, it's a much smaller number, but let's say 2 to 4. Most of the women I see that are in their 30s, 40s, long before menopause, or certainly those in perimenopause or later, it's zero. The free testosterone is 0 point something. And they've been told, well, yeah, your testosterone level's 50. It looks okay. Well, that's not okay. And so it is just the way things are. Conventional physicians have not been trained in hormone optimization, and many still don't understand what a low testosterone level is. You're 350. The range goes from 280 to 1,000, so you're still in the normal range. Well, no, I've got this long checklist of symptoms: fatigue, inflammation, joint pain, brain fog, I'm tired, I'm irritable, I'm grumpy, I'm depressed, I'm having panic attacks, whatever. I see the spectrum of behavioral changes with low hormone levels, particularly testosterone. Persistent fatigue, again, the number one cause is hormone abnormalities. Is thyroid, free T3 is low. Most conventional physicians, unless the TSH, thyroid stimulating hormone from the pituitary, unless that's elevated, you're not going to see a thyroid prescription. And subclinical hypothyroidism, called Wilson syndrome, from a friend of mine, Dr. Wilson, who helped determine this a number of maybe 10 plus years ago, is that people feel significantly better when we're in the upper ends of the normal range. And so it affects immune function. We know that you heal better when you have optimal hormone levels, from testosterone to DHEA. We measure IGF-1, insulin-like growth factor, which is what we measure for human growth hormone. And we use peptides to help increase growth hormone. That's the buzzword lately. Well, there's a lot of different peptides. And so from sexual function to inflammation to improving human growth hormone levels, to improving collagen, fine lines, wrinkles, skin, there's peptides used for everything. And so we do DNA methylation testing, a type of genetic testing, and biologic age testing that gives us biologic versus chronologic age, and does give us the status of the immune system, whether it's optimal, average, or below average. And so I can tell you, in 22, going on 23 years of doing this, I've seen it all. And I have seen dramatic changes in people. I saw a young woman this morning in her early 40s who does Pilates. She does she's just always active. And she said this morning, I just go, 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 go. And it's hard to slow down and rest at night. We were talking about that. But she said, my husband is really happy with you because all my PMS symptoms are gone. I'm not moody, bitchy, and bloaty at that time of the month. And he said, I'm a lot easier to be around. Well, great. Those are the results we expect to see. People are just happy. They're functioning from the inside out. And then, sure, it affects mood, it affects memory, brain fog, motivation, all of that. But even more importantly, when we restore hormone levels for men and women, you're healthier from the inside out, whether it be immune system function, not having as many colds. We like to keep the vitamin D levels between 60 and 100. Most people walk in deficient around 30 or less for a reason. Everything works better glucose metabolism, better lipid metabolism, better muscle definition, muscle metabolism. Everything is interlinked. And the hormones really are the key to alleviating the symptoms that you may have with memory, brain fog, motivation, etc. And so it's all tied together, and it's very rewarding when we see those things change for people. I saw a gal yesterday. Her husband became a patient first. She came in July. That was 3 months ago. It's now mid-October. And I haven't seen her since that first event. I see people around a month just to make sure we're on track and the levels are coming up. But we had started her on some testosterone, DHEA, a number of vitamins, a GLP-1 inhibitor to help with weight loss. I almost didn't recognize her. She's lost 30 pounds in 3 months. She's full of energy. She feels great. She was extremely grateful. She's like, I just feel like my old self again. And she was a young woman, but she felt terrible. She couldn't do anything to help get the pounds off after she had the babies and those things. And so, it is extremely satisfying from my standpoint to have people transformed right in front of my eyes. It's just very rewarding type of medicine, to be able to see the changes, to have people be grateful. In the past, it was a rare thing to have people ask you. I did primary care, sports medicine, and family medicine, and beyond the athletes and all that, everybody was motivated to get better. But people came into the office with what we call a chief complaint. Nobody came in with a chief happy report. They came in to complain about something. And we did our best and did whatever, and rarely ever get a thank you from patients. So this is something that's been a game changer for me professionally. I have fun. I love what I do. I love seeing people come in and knowing that I had a role in helping to improve the quality of their life and their relationships. If someone has persistent fatigue, usually it's because whatever method we've chosen, we don't have their hormones, their testosterone particularly, in the optimal range yet. Maybe the lozenge under the tongue for women isn't absorbing correctly, and we switch to a cream or pellet therapy or increase the dosage on any self-injections. It has to be, it's not just, one and done, see you in 6 months or a year. I monitor this stuff quarterly. Every 3 months, we're doing blood work and fine tuning and adjusting, and people fill out the same 20-question checklist that on the far left side says never, 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 and on the right says severe. And as I tell them, I want you to live on the left side of this page. What do you mean? I mean, I don't want you to have any of these symptoms. And so when they come in, and let's say their testosterone's actually in a really good range, they should be feeling better. Well, it may be blood sugar. It may be, and usually then is thyroid. In my book, it's thyroid till proven otherwise. Is your free T3 in an optimal range? And so when we change those things and affect them to upper limits of normal, people feel better. The last one I address, I call it the icing on the cake. First, we bake the cake. That's, all the routine hormones, vitamins, nutrients, things that that we should be doing, but probably aren't anyway. And then it's peptides for growth hormone, peptides for inflammation, peptides for better skin, hair, and nails, better sexual function. There are a number of things that we can ice the cake with, so to speak. I've touched on this before. There's no question that what works the best and the fastest to turn people around is generally optimizing testosterone, optimizing thyroid, getting people off the toxic crap that they're eating, getting microplastics and estrogenic compounds out of their diet, getting sugar out of their life, a high protein carnivore style diet, even ketogenic style diet to reduce and utilize stored fat for energy. And so it's usually eliminating sugar, getting off the couch and being active. You don't have to go to the gym for an hour a day to be healthy. Actually, 20 minutes of high intensity is plenty, and that doesn't have to be every day. And so walking, hiking, biking, just taking the stairs instead of the elevator at work and getting those sugary drinks, never touching them, having fresh water, unsweetened tea, green tea, things of that effect sound real simple and easy. But when you combine doing all of that together, the results are tremendous. The body responds the way you would think it should by not being in a toxic environment. We have a lot of videos and a lot of information on the website. You just go on the bottom of the screen to aspen-regenerativemedicine.com, listen to more podcasts. If you haven't seen my book on Amazon, it's a bestseller, Beyond the Fountain of Youth, the same name as this podcast, where I literally go through my journey for the last 20 years from A to Z, from, hormone therapy to stem cell therapy, red light, vitamins, nutrients, IVs, high dose ozone, EBO2, blood purification, things that have a tremendous impact on your sense of well-being and on your energy levels. So I would love doing this and would love to have a talk.